Okay, we're going to start with Chapter 30, Non-Opioid Analgesics. There is the first generation and second generation. We will discuss both. The first generation of the non-steroidal anti-inflammatory drugs, or NSAIDs as they're abbreviated, are your aspirin, which, remember, it has another characteristics of the platelet, antiplatelet aggregation, so to keep your platelets from clotting, especially for the people that have had strokes in the past, have heart problems, heart disease, heart disorders, cardiac disorders. Then they may be on like an 81 milligram baby aspirin daily. Your ibuprofen or your Motrin, ketorolac, which is your Toradol, naproxen, Aleve, indomethacin, Indocin, diflucanac, which is your Voltaren, and then your meloxicam, which is Mobic. The actions of your NSAIDs, inhibition of COX-1 can result in decreased platelet aggregation and kidney damage. This is going to be more your aspirin. Inhibition of COX-2 receptor results in decreased inflammation, fever, and pain. Okay, therapeutic uses, inflammation suppression and fever, analgesia for mild to moderate pain, dysmenorrhea, which is difficult periods, inhibition of your platelet aggregation, which is your aspirin. Complications that can occur, dyspepsia, which is indigestion. Some of your clients, this is going to be more of the upper abdominal discomfort. Your patients will complain of a burning sensation, bloating or gassiness, nausea. They may feel full a lot quicker, and after eating. Pain, heartburn, nausea. These can damage the gastric mucosa, which can ultimately lead to a GI bleed. So if they're vomiting blood, remember it's going to be that coffee ground emesis, and then it could end up leading to perforation if it's a long-term use. The risk is obviously increased for older adults, clients who smoke or have alcohol use disorders, and those that have a history of peptic ulcers or previous inability to tolerate NSAIDs. So sometimes the provider may prescribe prophylactically misoprostol to help with these. So you need to just warn your patients to look for any signs and symptoms of a GI bleed. So passing of dark, black or dark colored stools, or if it's bright red, then that means it's a fresh bleed that is occurring at this time. The emesis, coffee ground emesis, if it's an upper GI bleed, they may have severe abdominal pain, nausea, vomiting. A lot of times if somebody needs to be on these for a long period of time, then they'll prescribe a proton pump inhibitor, such as omeprazole, which is your Prilosec, or your H2 receptor antagonists, such as Ratidine or Zantac, to help decrease that ulcer formation. The next, so then they need to avoid alcohol when taking these meds, and take these medications with food or with at least 8 ounces of water or milk to help decrease the GI effects of it. Impaired kidney function. So what we're looking for is decreased urine output, weight gain due to fluid retention, increased BUN and creatinine levels. If those start increasing, then we know we're starting to have some impaired kidney function. Older adults and clients that have heart failure are going to be more at risk for the impaired kidney function with these medications. So obviously monitor strict INOs, and then monitor the lab values of the BUN and the creatinine to watch the kidney functions. Increased risk of heart attack and stroke. This is with non-aspirin NSAIDs. The smallest effective dose for clients who already have cardiovascular disease, you want the smallest dose. So then there's the two things that can occur with aspirin. The first one is Okay, we'll go back. Bone marrow suppression. This is on page 273 for ibuprofen. It can cause bone marrow suppression to where our red blood cells are not producing the way that they need to be in the bone marrow. Okay, sorry. Now for aspirin, we're going to talk about that separately. Two conditions can happen with aspirin spasms, which is tinnitus, which is ringing in the ear, sweating, flushing, headache, dizziness, drowsiness, confusion, nausea, vomiting, diarrhea, tachycardia, tachypnea, and respiratory alkalosis. So they need to notify their provider if any of this starts occurring while they're taking aspirin, and stop taking the aspirin immediately. Rye syndrome, which you guys have probably heard of. This is giving aspirin to children or adolescents who have a viral illness, such as in the influenza, chickenpox. This is a rare complication, so just avoid giving aspirin to children in general, and especially if they have a viral infection. The next thing, aspirin toxicity. It can progress from mild findings to salicylisms. They're going to have a high fever. They're going to be acidotic, dehydrated. There'll be electrolyte imbalances. They could go into coma, respiratory depression, and then ultimately respiratory failure. This is an emergency, medical emergency. We need to administer charcoal immediately to decrease the absorption of the aspirin. And then some people may end up having to do hemodialysis to remove the aspirin from the body. So the nursing actions that we need to do, we need to cool them with tepid water, assist with correcting dehydration, so IV fluids, electrolyte imbalance, and then reversing the acidosis, promoting the salicylate excretion with bicarbonate, and then also, like I said, with the hemodialysis, and then performing gastric lavage. Okay, contraindications for the first generation NSAIDs, pregnancy risk category D, peptic ulcer disease and bleeding disorders, hypersensitivity to the medication, children and adolescents due to Rye syndrome, and then the history of bronchospasms with aspirin or other NSAIDs, and then your kidney and hepatic disease with ibuprofen. Precautions, older adult clients, bleeding disorders, history of alcohol use, anticoagulants, smoked cigarettes, and then the H. pylori, which is found when they do in the gut, when they go take samples from an I can't think of it. Sorry, guys. Cardiac disorders is ibuprofen. Interactions, anticoagulants, glucocorticoids, alcohol, and anything over the counter. You need to advise the client that they need to consult their physician or their provider before they take anything over the counter if they're taking any of these medications. Okay, ibuprofen interactions. This is on 274. Antihypertensive, furosemide, thiazide diuretics, oral anti-diabetic meds, aspirin, corticosteroids, alcohol, tobacco, anticoagulants, lithium, other NSAIDs, thrombolytics, antiplatelets, and salicylates. Okay, your second generation medication is your Celebrex. Contraindications, this is going to be last choice. It was taken off the market for a while due to showing increased heart attacks or strokes with this. It's contraindicated if anybody is allergic to sulfonamides. And then precautions, anybody that has cardiovascular disease. Interactions are your anticoagulants, glucocorticoids, alcohol, ibuprofen will decrease the platelets effects of low-dose aspirin. Over-the-counter medications like your antacids, your herbals, and then any natural products. Second generation nursing considerations, they need to be stopped at least for 1 week prior to any surgery or giving childbirth. They need to be taken with 8 ounces of water or milk, and then food. Do not chew or crush the enteric-coated or sustained release aspirin. And then notify the provider if there's any manifestations of gastric discomfort or ulceration. And then solipsism, just notify the physician and quit taking that medication at that time. Okay. Then the last one is Tylenol, or acetaminophen. It has the analgesic and antipyretic effects. It slows the production of prostaglandins in the CNS. It's used for pain and fever. Complications are rare, so as long as they follow the directions on the bottle, then typically you're not going to see a lot of complications with acetaminophen. Liver toxicity, it does affect the liver. Acute toxicity, the early manifestations that you're going to see is nausea, vomiting, diarrhea, sweating, abdominal discomfort, progressing to hepatic failure, coma, and then death. The antidote to this is acetylcysteine is what you're going to give as the antidote to an overdose of acetaminophen. We've had to do this in ICU. We have a lot of people that, I don't say a lot of people, but we've had several people come in that have had to try to overdose on acetaminophen, but all they're really doing is damaging their liver. And yes, if it gets to the point, it can lead to their death. But it's a lot longer and a slower death. So client education that you want to give is take the acetaminophen at safe doses. Do not exceed, they used to be 4 grams. Now they have put it down to 3 grams is the new guidelines. Carefully follow the provider's administration. For concurrent malnutrition, limit the acetaminophen to 3 grams. If consuming more than 3 alcoholic drinks per day, don't go over 2 grams. And limit the over-the-counter dosage of acetaminophen when taking any prescriptions that have it. So remember, some of your narcotics will have acetaminophen in it. So you want to tell them that they can take ibuprofen, but no Tylenol while they're taking the narcotic medication. Okay, precautions. Anybody that has 3 or more alcoholic drinks a day and warfarin, because it can affect the bleeding time. Interactions, once again, alcohol and warfarin. And then nursing considerations, keep track of the daily acetaminophen intake, water of 8 ounces with or without food. And then FDA recommends only 1 product. So this is if they're on the narcotic with the acetaminophen in it, then don't be taking Tylenol on top of that. And then once again, remember what the max dose in a 24-hour period is. The new guidelines is 3 grams, but go by your agency's policy on what their recommendations are. And then overdose, remember cysteine to give as the antidote for acetaminophen, acetylcysteine. And you can give it IV or PO to prevent liver damage. PO administration through the nasogastric tube to prevent the emesis and subsequent aspiration. So we obviously don't want them to get this down into their lungs because then that could lead to aspiration pneumonia, and then you're fighting something else on top of trying to get them cured of the Tylenol or the acetaminophen in their system.